So there are actually two ways to define harm reduction. There's lowercase h&r harm reduction, which is simply a set of practical interventions that reduce harm or reduce the negative consequences associated with drug use. This includes complete abstinence from drugs, but can also mean using drugs more safely. Lowercase h&r harm reduction is commonly associated with having access to clean syringes and safe syringe disposal, access to naloxone, aka Narcan, and actually most recently, supervised consumption sites. The capitalized H&R harm reduction is actually a political philosophy and a movement centered on supporting the health and dignity of people who use drugs. It's about moving beyond the stigma of drug use and the criminalization of addiction and mental illness. And it's really about creating a more just world where we can see the full humanity and potential of people who use drugs. Harm reduction has its roots across multiple social movements in the 60s, 70s, and 80s, like the Black Panther Party's free breakfast program and free clinics in Oakland, the Young Lords acupuncture program in the South Bronx, the feminist movement for reproductive rights, and the LGBTQ response to the AIDS crisis in the 80s.
That's amazing. And I appreciate you recognizing the roots of harm reduction, Danny, because you're right. Health is more than medication, more than doctors and just hospital beds. Health is about having a roof over your head, being able to eat food and nourish your body. Health is having equal opportunities to pursue your own happiness, but without stigma or discrimination from other people, institutions, or ideologies. So it's hard to be healthy without justice and equity. So one thing we always do is prescribe naloxone, which is, Narcan. This is the rescue medication for an accidental opioid overdose. Now, at your first appointment and on an annual basis, we prescribe Narcan to our patients. This is harm reduction. In the case of Suboxone treatment was not adequate for the patient, if they continue with opioid use, this will actually save their life. It could also be used by the patient on another person. Another way we practice harm reduction is that we focus on treating the opiate addiction. If there's a concurrent substance use or another substance use disorder, sometimes based on our assessment of the patient's overall health, we may still treat the opioid addiction, even if another addiction is going untreated. So if you have a methamphetamine and opioid addiction, here at Bicycle, we may consider treating with Suboxone, even if you continue to use your methamphetamine.
An emphasis on the may consider. Sometimes it's unsafe for us to care for patients over telehealth if it seems like they just need more intensive supported care. So you'll find with certain treatment facilities or providers, they enforce an abstinence-only policy, which works for some people, but not everyone is wanting to or is ready to stop their use of other substances. That's harm reduction. Another harm reduction strategy is encouraging safer ways to use drugs, whether it's having Narcan on hand, avoiding using alone, avoiding driving after using, or using a substance orally or rectally instead of injecting in the veins or muscle. So these are all some ways that we try to incorporate harm reduction here at Bicycle Health.